Hi, everybody. My name is Gabrielle Harris, and I'm a research assistant with the University of Miami Public Health Policy Lab. The UM Public Health Policy Lab and the AHF Global Public Health Institute are honored to welcome you to our Emerging Challenges in Global Public Health webinar series, a forum dedicated to knowledge exchange, rigorous discussion, and actionable solutions. It is now my great pleasure to introduce our moderator for this session, Mr. Gee. Mr. Gee is a lawyer and policy expert focused on global health governance, equity, and institutional reform. He currently serves as director of the AHF Global Public Health Institute at the University of Miami. We are deeply grateful for your leadership and for guiding today's conversation. Once again, thank you all for being here. I look forward to an insightful and thought-provoking discussion. Mr. Gee, the floor is yours.
Oh, good morning, good afternoon, and good evening to all the colleagues and friends who are joining us across the world for today's discussion on the pandemic agreement, the Pathogen Access and Benefit-Sharing system, and what comes next in this negotiation process. In the name of the HF Global Public Health Institute and the University of Miami Policy Lab, I welcome you. Today, we will begin our conversation with a short introduction to the topic, and then I will introduce our esteemed panel and open the floor for opening remarks. The discussion will then progress to a moderated discussion on specific topics that will be interspersed with Q&A from the audience. For those of you who may not be completely familiar with today's topic, in May of this year, the World Health Assembly approved a draft text of the pandemic agreement, a historical feat of multilateralism in a time where multilateralism is in retraction across the globe. Within the agreement are 35 articles that move both upstream and downstream from the IHR, covering a range of thematic areas that include pandemic prevention and surveillance, One Health, social and health system capacities, access to pandemic health products, international cooperation, financial support, and governance. And while equity has been described as the cornerstone of this agreement, much remains to be desired regarding binding obligations that will make it operable in practice. In the word of Nature's editorial board from a publication a couple of years ago, and I quote, "During the COVID-19 pandemic, millions of people died because the fundamental principles of equity between nations was ignored during the outbreak, and that must not be allowed to happen again," end quote. So using this agreement to address the unacceptable inequity observed during this last pandemic has become a central charge to most of the countries involved. As one of the pillars of this agreement, which remain to be negotiated, and we hope that will operationalize equity in practice, we have the Pathogen Access and Benefit-Sharing system, or PABS, under Article 12. As proposed, under what has already been negotiated, the WHO PABS system would provide for timely access to pathogen samples and genomic sequences in exchange for annual financial contributions and commitment by participating countries and manufacturers to set aside a limited percentage of pandemic-related health products as shared benefits. While a floor of 10% of real-time donations to WHO has been agreed to in the event of a pandemic, many questions remain to be resolved, including its overall scope and format, as well as key substantive topics covering additional benefits sharing provisions, such as capacity building assistance and tech transfer, modalities and operating dimensions, what pathogens are included or covered, and whether feques or other types of health emergencies will trigger benefits sharing. PABS negotiations begin officially tomorrow with the first meeting of the IGWIG, or the Intergovernmental Working Group, that has been created to carry these negotiations. And it's important to note that unless the PABS annex is successfully negotiated, the pandemic agreement will not open for signature. Today, we are joined by a distinguished panel of guests that includes Professor Julio Hakuturina, who is the Director of Humanitarian Affairs at the African Union Commission since October 2022. He is a medical doctor with over 20 years of expert consultant, physician, public health specialist, professor of epidemiology, and continental policy designer in health and humanitarian affairs. He has also served as Madagascar's Minister of Health. We are also joined by Agri Aluso, who is the Executive Director of the Resilience Action Network, or RANA, and the African Director of the Global Policy Lead in the Pandemic Action Network. From governments, we have Nurfiza or Fiza Hamza, who serves as Minister Counselor of the Health and the Permanent Mission of Malaysia to the United Nations and other international organizations in Geneva, where she brings extensive experience from the Malaysian Ministry of Health, where she has contributed to national efforts in pharmaceutical policy, health technology, assessment, health financing, and in the pandemic agreement negotiations. We're also joined by Professor Yap Boom II, who is Deputy Head of the Africa CDC, Mpox Continental Response, and is also a member of the Board of Directors of Epicenter and MSF West and Central Africa. He's an adjunct professor of epidemiology at the Yale School of Public Health and professor of microbiology at Mbara University of Science and Technology in Uganda. Last but not least, we're also joined by Rafaela Seixas, who's a Brazilian diplomat, currently serving as Deputy Chief at the Global Health Division in the Ministry of Foreign Affairs. She is a graduate by law by the Federal University of Bahia with an exchange period in the Political Science Institute of Paris. She also holds a master's degree in law by the University of Brasilia, and she's stepping in for Igor da Silva Barbosa, who might be joining us later in this panel. Igor has been deeply involved in the pandemic agreement negotiations and is currently serving as Division Chief of Global Health at the Ministry of Foreign Affairs for the government of Brazil. So to kick off our discussion, we will open this panel with a general prompt, which participants may take in whichever way that they want. And the prompt is the following. A draft text of the pandemic agreement has been approved by the World Health Assembly. From your perspective, what has been achieved? What challenges lie ahead? And how can this agreement advance equity while making the world safer? Professor Julio, we will open the floor with your remarks.
Thank you for the question, and I'd like to thank you for this webinar today. So, the pandemic agreement marks a significant for the future of pandemic prevention in the world, preparedness and response also. From the perspective of African Union Commission, I would like to highlight 3 points. First, we recognize the value of having a global legal framework that formally acknowledges the collective responsibility for preventing managing pandemics. The text reflects important progress in several areas. You know than I do what are these areas, but I'd like to say that this agreement reinforces the importance of international cooperation, transparency, and accountability, values that the African Union has consistently advocated for. Secondly, the provisions on equity acknowledged still lack binding obligations and enforcement mechanism. There are ambiguities around how benefit sharing from pathogen genome access will be operationalized and how low and middle-income countries will be supported to build manufacturing and surveillance capacities. And the last one, to be transformative, the pandemic agreement must go beyond declarations. It must institutionalize equity by creating access mechanisms, mandating inclusive governance, and securing financing that empowers low and middle income countries. The African Union Commission is ready to work with member states and partners like you to ensure that implementation is guided by the realities on the ground. And we must ensure that the lesson from COVID-19, including the inequities in vaccine access and diagnostics, are not forgotten, but driven systematic reform. Thank you.
Thank you, Professor Julio. Next, we will go to Fiza Hamza.
Thank you, Guy, for organizing this event. So as we all know that the pandemic agreement is already adopted at WHA, where 124 member states vote in favor, while 11 abstentions. It's the first legally binding instrument on how countries should act and collaborate in PPPR, Pandemic Prevention, Preparedness and Response. So some of the key provisions that was already introduced in the pandemic agreement is the principle of equity, solidarity, and recognizing the different levels of capacity and capabilities in pandemic prevention, preparedness, and response. And I think by way of order, we have secured some level of commitments on prevention through a promotion of One Health approach, health system resilience, health workforce strengthening, and a more diversified R&D and manufacturing, financing PPPR, and equitable access to pandemic-related health products. I think some notable achievement from my personal view is the sharing of comparator products in conduct of clinical trials that will help speed up the R&D process needed to demonstrate efficacy and safety. The conditionalities in public-funded research that promotes timely and equitable access to products, since most products funding uses a large portion of public investments anyway. The coordinating financial mechanism that pools external funding and a better alignment with a 5-year financial strategy, and working towards a more geographically diversified production and setting up a new global supply chain network that reduces reliance on single sources and mitigate risks associated with geographical concentration. I think overall, pandemic agreement established a new legal and institutional foundation that can be built upon for a more coordinated and collaborative approach, and it represents a political commitment to improve international cooperation in PPPR. And so what challenges lies ahead? As we know, PABS system annex is still under negotiation. We will present the outcome by May 2026 at the next World Health Assembly, in which until then, the PA will not be open for signature and ratification. So PA is contingent upon the successful PABS negotiation. And I think the challenge now is how to design an effective PABS system. And while the pandemic agreement represents a significant step forward in codifying global solidarity and equity principles, I think it must be recognized that some commitments remain aspirational. So implementation will depend not on the actual text, but on political choice made by each party in how they interpret and operationalize these provisions. At the same time, I think there is preparatory work to be done, such as GSTL network, the terms of reference of the coordinating financial mechanism in the context of resource-constrained WHO is how we should support WHO to do the work asked in the PA, and how the secretary of the PA is robust and fit for purpose. You know, a treaty without implementation muscle is just paper. So WHO must be equipped not to just convene, but to deliver. And so how we see this agreement actually advance equity and make the world safer. I believe there is provisions on equitable access to countermeasures, on the mandatory sharing of 20% of VTDs, vaccine therapeutic and diagnostic, through the PABS system to address some of the past imbalances, the setting up of a framework of data sharing with benefit sharing that will set a crucial new norm and facilitate equity. It also encourages building local R&D and production capacity. I think this decentralized production and enhances health sovereignty, particularly in Africa, Asia, and Latin America, seeing developing countries as collaborators in a global effort and rather than just recipients or aid or markets for developed nations. And lastly, I think equity is also about preventions. So ensuring all countries can detect and respond to threats would actually also advance equity and make the world safer.
Thank you, Fiza. Next, I'll bring in Aubrey, who is here stepping in the shoes for all of civil society who has been involved in these agreement negotiations from the start. Aubrey, what is your perspective on how this agreement can advance equity and make the world safer?
Thank you, Guri, and thanks, colleagues. Good morning, good afternoon, depending on where you are. I think I echo many of the sentiments, all the sentiments that have been expressed by the speakers before me. This was, in a very trying moment, a win for multilateralism, which, as we know, is really facing a lot of headwinds. And it took 3 years, but we are happy that we have something that we can build on. We have some building blocks that which was well acknowledged as not being the ceiling but the floor, and so we hope that spirit of this not being this being like a minimalist piece that therefore has opportunity to be built upon will come to bear. And of course, it centers, formally recognizes equity, which was one of the biggest challenges in the COVID-19 response. And many of us in the civil society side, I think that has been our clarion call. Really, we wanted an agreement that demonstrates a departure from what we saw during COVID and what we are, what we are likely to see if we were to be faced with a globally impactful type of pandemic like COVID. We have other pandemics, and we are yet to see that in action. We hope that this global show of solidarity will come to bear when this agreement, come into force after the PABS has been successfully negotiated, which we hope will be. And I think just acknowledging the same point that Fiza talked about, the conditional, really putting accountability imperatives around publicly funded research and development. I think that is something we are very, very keen on. We saw a lot of publicly funded initiatives being diverted to private gain, and which are the biggest barriers to equity. And we hope that with this being in force, we will be able to see more accountability in terms of acknowledging research and development that have been funded by public funds, being used to support equitable access in all geographies. And of course, the supply chain barriers that we all were concerned about. Of course, we wanted something that really builds on the Act A and builds on the lessons. It's not perfect, but I think we have opportunity to build on that. Of course, the issue of PABS is something that we are very, very hopeful about, particularly those of us from Africa and LMIC generally. We really hope that this will be, a game changer in terms of really having something, a starting point that can help us mobilize resources on very good, platform of, shared responsibility, across the different sides of those who contribute pathogens, and also having access to the products that accrue from them, even though we hope that it would be more than just the transactional outcome of we gave you this, you give us a little. It should be more in the direction of structural transformation. And I think the PABS has that, the minimal statement there has room to expand and really provide for more opportunities to build technology transfers, skills sharing, and general cooperation in terms of capacity sharing across different regions. I think we hope that is something that will be incorporated in the PABS system. And of course, the One Health, the prevention piece is excellent. We hope it will have commensurate mechanism for financing, because I know that has been a challenge in terms of really expanding the responsibility for already financially constrained regions, giving them more responsibility, but not providing commensurate financing mechanism. We hope that will be provided for as the COP come into force and figure out how to help operationalize all these ambitions. and of course, many others. Just also quickly moving into the challenges ahead, I think many have been said, but I want to zero on the financing piece, which I think we had a better opportunity. One area we really were hoping we would have shift is having a system that has not the discretional kind of financing that we saw, because we know a lot of pledges were not fulfilled. So we cannot bank our hopes again on a discretional contribution mechanism when we know that usually doesn't come to fruition. We need some enforceable financing framework that would require for different states or different actors to contribute and benefit from such a financing arrangement in ways that would help us have resources that would help us operationalize ambitions in peacetime and not waiting for crisis. Because I think what we have, a lot of the other provisions are aspirational, as has been said, and will depend on the political will. And of course, I think the other bit that has been talked about is the enforceability, and we really hope the COP will help action those accountability imperatives, because as it is now, a lot of them are aspirational with a lot of conditionalities or qualifiers that which sometimes we want to say, like, what was, if you're evaluating what was different, what could not have happened in the pre-pandemic, pre-COVID, that would happen now because of this. Because we could still have agreed on mutually agreed terms, we would have still cooperated. But then now, what would be the changing, the different thing that would be so instrumental in taking us forward in terms of really actioning the equity agenda here. So those are some of the reflections that we have. But I think we have opportunity to build on trust. We have to do a lot of trust building. I know the negotiations were very, very, very hot. And I think it's a time to really rebuild trust and rebuild that, belief in global solidarity. And I think we have the goodwill. And we hope civil society organizations who I don't think we'll have, according to what we have already had from the IGWIG, we don't have a lot of formal space, recognition in the space. But we hope there's a way to really tap into the civil society voices to be able to inform the ongoing negotiations on PABS, because we really are connected to the impacted communities, and a lot of our constituents have expert opinions that can really help take this process forward. Thank you, Gui.
Thank you, Audrey. Professor Yakbom, what do you have to say to contribute to our conversation?
Yes, thank you so much, Guy, and the organizers for inviting me and inviting Africa CDC, and also for having such a wonderful panel with a large diversity. And I concur with my fellow panelists on appreciating that this is a significant milestone. Really coming back from the exposed weakness from the COVID-19, but not only. As you mentioned, I'm currently leading the Mpox response in the continent. And what we are seeing, that is a pandemic that has already affected 23 countries in the continent. We have developed a plan where we need 6.4 million of vaccine. And then we've managed to mobilize 3 million. And as we do speak now, we have 0 dose of Mpox vaccine. While we know that those vaccine has been developed using the strains that has been coming from DRC, from CAR, and so on. So we are really still into that time. So therefore, the pandemic agreement, it's so important, because that's the first time that we really recognize equity and solidarity as a guiding principle. And I think that's critical. And for some point that I will take from my fellow panelists is that the pathogen access and benefit sharing is actually what we hope to be a concrete mechanism that if implemented properly, it can really correct the imbalance that has been happening in the history, where the global south has been used to develop tools later become inaccessible to the global south. And it's not we don't see it as a technical matter, but really as a matter of equity. And this goes far beyond the Mpox, the COVID, and the pandemic. If you take something as simple as cocoa, the population raised in cocoa in Ivory Coast, in Ghana, and some of those countries don't have access to chocolate. The same applies to people living in countries with gold, diamonds, and now we're talking about viruses. They cannot have access to the tools that are developed from them. This is not acceptable. So we really believe that this agreement will really push us toward more equity. But again, as mentioned, significant challenge remain. And the big issue, the test is actually on the operationalization of the agreement and the signature of the PABS, as it has been mentioned. So it will require some concrete funded action at the country level, which include the community has to be part, the civil society. They've been part of the conversation, but they need definitely to have more space because whatever you do for me, without me, is against me. So we need to make sure that the voice of the community is part of that conversation as we move toward the signature of the PABs. So at this point, I would say that the agreement will also go hand in hand with one thing that is very critical for Africa CDC, with the support to local manufacturing, the technological transfer. We've seen the one with Bavarian Nordics, with the Serum Institute of India and Mpox. We are also moving with them to see how we can have the same tech transfer in South Africa. So these are ways where we really want to move from the time of aid to the one of investment, where the continent can produce its own vaccine, test, and treatment. So to conclude in that first part, if we want to make the world safer, we must ensure that everyone is safe. And it only happens when equity is not just a principle that we see in agreement and paper, but actually a lived reality. Thank you.
Yeah, and that is an important point that you raise, right? Not just being a technical matter, but a matter of equity. When these negotiations started, there were many calls for equity, but as we found out in practice, that became more difficult to achieve than expected. So on this subject, let me bring in Rafaela Seixas, who's here representing the government of Brazil, who certainly has been a key player in these negotiations. What is your take on this, Rafaela?
Thank you so much. I'm here representing Igor. Igor was actually one of the Brazilian negotiators in Geneva, in our United Nations in Geneva. So from the Brazilian perspective, this is a very important treaty. First of all, because it's the second treaty in global health that we have. The first one being the Tobacco Convention, adopted more than 20 years ago. So this is, I would say, this is a milestone in global health, considering what we suffered from COVID recently. I think it's a great victory for global health in a time of so many geopolitical uncertainties. And in a time of also backlashes. And I'm so happy to hear so many of you defending the principle of equity, because recently I have been in negotiations at the regional level at Pan American Health Organization, DC, and unfortunately, the United States of America requested to remove the word equity from all the resolutions that were being discussed in the executive committee of PABS, for example. So I think having a treaty like that, which is legally binding and bringing principles like equity, not only equality but equity, it's really important, especially in this time. One more I can say for Brazil, this is really important. It was a very difficult treaty to be negotiated. It was more than 13 rounds of negotiations, and Brazil represented the region of Americas. For us, it's very important that this treaty brings the matters of international cooperation, public health, strengthening surveillance and prevention capacities. It brings also the principle of One Health and efforts to strengthen health systems. I think a very good innovation in this treaty is the creation of financial coordination mechanism to identify and mobilize financial resources, as well as the provision of the conference of the parties to advance national measures in favor of health and monitoring the implementation of the treaty. And of course, we should see how it will work in practice. And of course, Brazil will continue to engage in multilateral efforts aimed at improving global health governance. Another very good point of this treaty that I consider is the fact that it touches in subjects like access to medicines, vaccines, and the need to make the production of medicine and vaccines and other health supplies products better geographically distributed. And in this sense, I want to stress that recently, yesterday, there was a resolution approved in the Human Rights Council just yesterday, a resolution that was proposed by a core group that Brazil coordinated, a resolution about access to medicines, vaccines, and other health products. And this resolution also quotes the pandemic treaty in this aspect that production of medicines and vaccines should be more locally, more geographically distributed. And I think it's a good text also to put in dialogue with the pandemic treaty. Yeah, and currently the Brazilian government, we are discussing internally what will be the Brazilian position regarding the
Rafaela, I think we're having a little bit of difficult time hearing you now with the microphone. Maybe if you could speak closer to it. Yeah, just now the volume dropped. Still a little bit low, but it's okay.
to the computer. Is it better?
That's better. That's better now.
Okay, sorry. So I was saying that currently the Brazilian government is forming its national position regarding the Pathogen Access and Benefit-Sharing system, the PABS system. We are discussing with the other ministries, Minister of Science and Technology, Ministry of Health, of course, Ministry of Industry. What is our position? Because we understand that this might not be completely open access, but also it should not be completely closed. This is not the proposal and the intention of the pandemic agreement. So we are forming our national position, and we are actually the co-chair of this body that is negotiating this annex to the pandemic agreement. So these are my initial remarks about this. Brazil is very happy to have concluded this agreement after almost 3 years of negotiation and after 13 rounds of negotiation. And as I said in the beginning, in a very difficult geopolitical moment of backlash. And yes, that's it. We are happy, and we hope to improve the agreement always forward and to put it into practice. The words there, principles and the words there.
Thank you, Rafaela. So for the next round of questions, to give everyone an opportunity to speak, we'll ask that the speakers keep their responses slightly shorter, and we will get some comprehensiveness from the collective. So the first topic that we have is the PABS system. And the question is quite direct. I will first direct a specific question to Professor Julio, and then I will open up the floor to other participants who may wish to provide an input on what the PABS system annex must get it right for it to work in practice and to advance equitable access. But before that, considering how many countries are involved in these negotiations and the divergence and also convergence of interests that happens, Dr. Julio, how can we galvanize a common position across member states to ensure that the principles of equity are upheld and that meaningfully addressed through the PABS system?
Okay, thank you for this question. I'd like just only to emphasize that African Union Commission is a continental institution who ensure the policy system in general in Africa. And when we talk about this agreement, the Commission has a clear mandate to promote policy, coherence, integration, and solidarity among its member states. Of course, some member states, we need also like a negotiation inside of member states in order to get a common position, because it is not very easy to get common position. So in the context of the pandemic agreement, this mandate becomes even more critical in ensuring that the principle of equity is not only upheld but personalized. The Commission plays a central role in coordinating a common African position. We recognize that equity, whether in access to vaccine, pathogen genome sharing, financing, or representations, cannot be achieved in a fragmented manner. The Commission is therefore actively facilitating consultations among African Union member states in order to build consensus on priorities and red line, ensuring that African interests are clearly reflected in global negotiations. Our goal as African Union Commission is to ensure that equity is emphasized as a legal and operational principle overall. The African Union Commission drives also advocacy for a system that respects Africa's sovereignty and development aspirations inside of the Agenda 2063. In this view, the equity is not just about access, it is about justice, ownership, and fairness in decision making. The Commission advocates for the fair sharing of benefits arising from access to medical and scientific technologies, the protection of member states' sovereignty over their health data, and biological materials, and also the inclusion of African institutions in a global governance structure. These elements are central to trust and legitimacy. Finally, on this way, as I said, African Union Commission is continental institution, and we have many specialized institutions, especially Africa CDC, which is one of the specialized institutions works for health. To say that African Union Commission supports member states in institutional readiness and alignment. We want to ensure that EU policy instruments, such as the Africa Health Strategy 2016-2030, the Africa Medicine Agency, the Pharmaceutical Manufacturing Plan for Africa, and others, of course, our CDC Africa, are aligned with the core equity provisions being negotiated. This helps member states domesticate global commitments in ways that are responsive to their national context. I took the floor on this way because, as I said, African Union Commission is a continental to ensure the common position, African common position in Africa as a policy. But at the meantime, as I said, also that our specialized institution, and I'm very happy to have my brother, Prof. Yap, to give you the details on the implementation of our common African position. Thank you.
So I see that Igor has now joined us, and I will recognize him in the upcoming questions. But before I turn to Fiza and Igor, thank you for joining us, Igor, on what should we expect from the upcoming negotiations from those who have been in the room and on the ground. I'm going to give Professor Bohm and Agri maybe an opportunity to give a brief response, 1 to 2 minutes, of what is needed from a PABS annex to get it right. Professor Bohm, if you would want to begin.
Yes, very quickly. As I mentioned earlier, and thanks to my brother, it's critical to correct the historical imbalance. Shortly, in Sierra Leone, around 10 years ago, a diagnostic study on Lassa fever managed to develop rapid tests. And 4 years after that, when an outbreak happened, the community that were involved on providing the sample, the evidence, and all those were not able to access those tests. So now we really need, through the PABS, to have a fair compromise where the community will find themselves, depending on how they contribute through the sample, the trial, or whichever. We need to ensure that they have that access. And for that, the PABS need to be legally bind the stakeholders. So we talk about the industry. We appreciate their contribution, but we cannot also accept that the commercial interests override the collective will of the majority of countries. So at this point, it's critical for Africa CDC, African Union, and so on to insist that we respect the right for the community, but also issues such as data sovereignty to ensure that the country retain and control the biological material that are used. That is critical for us. And last but not the least, is also to ensure that the benefit sharing must support local production. Because as much as we will be in the receiving end, this agreement and the PABS will not make a difference. So that's where Africa CDC, through African Union, will also push and ensure that those rights, the legal, the financial, the local manufacturer, will be respected. Thank you.
Agree. What must the agreement on PABS get it right?
Thank you. I think agreeing with what has been said by Prof and a colleague from Africa Union before, but I think one thing that I want to emphasize is, this agreement need to be legally binding and in ways that promotes accountability and enforceability. And I think also we the equity imperative, and I think what has already been reinforced in the text that is there. I just hope it will not be litigated and watered down. But if anything has to change, I think it should only be enhanced if need be. And I totally agree with Prof that we really need to go beyond the transactional element of 10%, 20%, but also incorporate very, very clear provisions around capacity sharing, skills and capability sharing, so that we can be able to really use this opportunity also to fulfill one of the great ambitions of the agreement of promoting diversified manufacturing capacity for commodities, medical countermeasures that would help us respond to future pandemics. So that would be my ask, and I really also hope, because I know time, given that we took 3 years in INB, I'm really hoping that we do not take another 2 years with this. So my humble ask is, countries come prepared. Let us consult, and civil society organizations and a lot of actors that we work with are happy to contribute their time to help, build flesh, so that when you go for negotiations, you have things that you can build upon, and not, take another 2 years negotiating the PABS, because pandemics are not waiting; they're already happening, as Prof said here.
So let me bring in Fiza, and then I will call on Igor for his remarks. Fiza, what should we expect from the upcoming PABS negotiations? In your view, very briefly, what lessons from the INB could be applied to what is to come? And what should the member states be doing between this first meeting and the first substantive meeting that will happen in September? What kind of actions can happen in order to drive this process forward in a successful way?
Yugi, in my personal view, the preview of PABS negotiation, I believe, will be politically delicate, legally complex, and I think heavily influenced by the unresolved tensions between the global south and global north country, as well as the industry actors. So I would assume that, for developing countries, there will be the likely position that we will be having is a strong push for equity, a binding benefit sharing, improving local production, and emphasizing ABS compatibility with national ABS law, and pushing for DSI safeguarding. So these are probably some of the positions that we will be in the PABS negotiation. For developed country, I think we heard before, there's a push for rapid data access, and there will be proposals for differentiated benefit sharing obligations. There's a preference, a range of options for benefit sharing that will help, that might be negotiated with WHO, and as well as IP protections. And so we also have these industry and pharma associations. They are like invisible negotiators in the room sometimes, and they will oppose these binding sharing obligations. They would prefer voluntary models. They will resist IP and tech transfer mandates. So this is likely some of the preview of all the perhaps positions between this set of actors. So what lessons from the INB negotiation? I think we realized that in terms of the PABS negotiation, that we will need to finish by a minimum of 1 year, less than 1 year. Then it's good to have a good time management. So to start early in text-based negotiation, not to wait that long. There's no perfect text. We should start with the text on screen and negotiate from there on. I think avoid procedural missteps, because I think during IMB we noticed there was procedural missteps. I would suppose there's lesson learned on that. So we hope that it can be improved. And I think we need to be aware of the lowest common denominator. This PABS system is very important for developing countries. So we want to have a high ambitions, and it needs a high level political will, and it should not be watered down just to achieve political consensus. So this some of the lessons from IMB process. And in terms of, I think, what we should prepare, what negotiators should prepare, I think equity cannot be negotiated at the last minute. It must be built in every phase through coordinated positions, active civil societies, and transparency. So I think we need to work hard from the starting point, and we need to understand each other and work our ways through understanding the foundational principles and the divergent views, and provide creative solutions. So I'll leave it at that. Thank you.
So thank you, Fiza. Last but not least, let me bring us Igor to take us out. Igor, you were one of the people that I would run to in Geneva at those last moments. And when we were all wondering whether or not it was going to get done, I remember that you looked at me after hours and you just sort of nodded and you said, well, we'll get it done. What words do you bring into this conversation about what to expect from these PABS negotiations and how we can successfully move forward? There are many countries and delegates and missions listening in right now. What is your word from the group, and now that Brazil has moved into this leadership position?
Well, thank you very much, Guilherme, for the invitation. I hope that you can hear me well.
We hear you well.
First of all, sorry for being late to the webinar. I was supposed to participate from the beginning, but my boss's boss called us for a last-minute meeting, so I had no option but to attend. But I'm here, and of course, thank the initiative as well. Very useful for us to discuss what to expect. Indeed, it was very long hours that we had, and not boring, I would say, tiring hours. But we were happy to achieve something as a result, and this was an important message to the international community as well, that WHO is still alive and kicking, and that countries are able to converge positions. We are going to continue to have the same challenges, probably even longer working hours to achieve the PABS. Brazil is consistently guided by the objectives of equity and solidarity, together with other developing countries, especially in the Group for Equity. And I acknowledge the presence of our esteemed colleague Fiza here, a very important delegate within the group as well. And I think that for the PABS Annex, what we are going to have is even a bigger challenge, because now we're going to have to discuss technicalities. We're going to have to make sure that the PABS system is a workable system, implementable system, is a system that actually brings to us what we are trying to achieve, which is better prevention, preparedness, and response, especially through investments coming from different interested parties, and strengthening our surveillance system, in strengthening countries' capacities, especially developing countries, to be able to share pathogens in a timely manner. And this can only be done if developing countries also have the guarantee to get something back in terms of financial support, technical support. But we also have to have what other colleagues mentioned, a word that is more equitable in terms of who access medical countermeasures when a pandemic hits. We saw that the imbalance in access was very stark, especially affecting the African region, but also countries in Latin America and Southeast Asia. And so this is what we're trying to remedy right now. And we hope to have good proposals. We are, as Brazil, already working. I thank Rafaela for being able to give an initial speech on behalf of Brazil and the Division of Global Health here. We are working already to have a Brazilian proposal, and we're going to try to make it as balanced and as fair as possible for us to be able to work on the text. Thank you so much for the space, and congratulations.
Right, so we are coming up on time here. Thank you all for your participation today. I'm going to give the last word to Agri Aloso as a fellow civil society representative to give a few words on the importance of civil society in this process, and also to leave us with a hopeful message for these upcoming negotiations. Agri.
I wish I could give the hopeful message, Gui, but I think I'll use this chance to just urge member states who are here and colleagues to really amplify the importance of involving civil society organizations. I think in terms of equity, we have been consistent supporters across the board. I think one thing that distinguishes civil society from the governmental side is that across the globe, we speak the same language. There's no global south, global north when it comes to how we are approaching things. All of us are pushing for equity. And I think we've had very good opportunities working across the board, with CSOs from the global north, CSOs from global south, working on their with their delegates to really get the why it is important to progress this. And Fiza, you are very right, and I'm happy you say that there are so many unseen negotiators. We hope those negotiators who are unseen could be CSOs as well, but unfortunately, they happen to be those who have financial muscles. We don't have those financial muscle, but we have the mandate and the legitimacy of the people, and I think that's something that is as important as any other thing. Particularly looking at that, this treaty this agreement really will rely on political mobilization to take to the next step. So just re-emphasizing what I had said earlier, that civil society organizations are ready and willing to be, free resource. We know we will have to look for resources somewhere else, but we are willing to really lend our effort, burn the midnight oil with you as we drive home this important piece, because we really think this is very, very critical for us, particularly those of us in Africa, as everybody has noted, and LMIC generally. So let's work together. Let's build the political legitimacy for it. Let us bring the voices of those impacted into the space, and let us drive the advocacy ambition home, because that's really what's going to make the difference. Thank you.
Thank you, Agri, and thank you to all of the participants who shared their time and perspective here with us today. On behalf of the HF Institute, the University of Miami Public Policy Lab, I thank you all, and to all the viewers for your coming here for this dialogue.
Thank you, everybody.